Welcome to the Health 210 podcast. Today we have with us another accomplished physician. She takes care of the largest organ in the human body, and she is my doctor, Dr. Karla Muñoz.
Well, that's a nice introduction. Thank you.
Absolutely. Well, thank you so much for being here and taking out the time to do this with us. We really appreciate it.
No, thanks for having me.
Cool. So if you could initially start with, we always like to know our guests more on a personal level. So where did you grow up and what, took you into medicine?
Okay, so I was born and raised in San Diego. I always say San Diego, California, because apparently there's a San Diego, Texas. And so I've asked that, apparently. But no, born and raised there. And then I was there all the way through, high school. And then after that, I went to college in Los Angeles at UCLA.
Okay.
And then after that, then I went to Boston. So I was at Harvard Medical School.
Nice.
And then finally went all the way back to Northern California. I went to Stanford for my dermatology training.
For residency.
For residency, exactly.
Yeah.
And then after that, then I bounced around in all sorts of different places for private practice and all that.
Okay. Mm-hmm. So family from California, families in California, you go to med school and then come back. Mm-hmm. Do you remember or do you remember a certain influence that got you into medicine or got you interested in medicine?
So growing up, I didn't want to do medicine. Actually, I always wanted to do rainforest biology. I had this whole concentration on that. And I thought, I was really leaning more towards PhD, actually.
I see.
Kind of growing up, my parents are not in science at all. They're not doctors either. But I just had this really big interest in science. I always liked it. Then as I got into high school, and again, this was as a kid, I was already interested in that. And in high school, I started candy striping as the volunteer in the hospitals. And I still loved the sciences, and I was kind of going along. I even did some work with March of Dimes. So I kind of was interested in, birth defects and pediatrics and maybe high-risk obstetrics, actually. And then I eventually, of course, then I decided, hey, I want to do medical school.
I see.
So,
okay.
And then I applied to MD and MD PhD, and I was accepted to both. But in the end, I decided to stick with MD.
Stick with MD. Mm-hmm. Okay, perfect. So more the volunteering experience and actually seeing it firsthand, getting that exposure to healthcare.
Yes.
And then how did you decide dermatology? Because it is kind of like a specific, interest. How did that come about?
That wasn't until second year of medical school, and I was doing the immunology side of things and microbiology, and then learning about immunology of the skin.
Yeah.
And so again, I wasn't interested in dermatology, and I came in from the science side.
I see.
And I loved immunology. That was part of my degree as a college student. And so when I saw that, that's what hooked me. Psoriasis and eczema, lymphomas, cutaneous lymphomas, things like that.
And how this, the different dermatological manifestations of, a lot of systemic stuff, right?
Absolutely, yeah, that's kind of that part of things.
So that's interesting, right? Because I think in for common people, if they think about skin, there's a lot of focus in the media about the aesthetics and, if it's like it's only the glamorous part of it, but the skin as an organ is doing a lot of other important functions that I think we don't focus on. If you could, for our listeners, tell us a little bit about the important things that skin does.
Okay. Oh gosh. See, like you said, the skin's the largest organ of our body, actually, and so one of the big things too is just thinking about skin cancer. So, that doesn't do anything for us, of course, but with UV radiation and from the sun, we get, we have to protect our skin. So that's number one.
Yeah.
Then our skin helps us, keep our moisture intact.
Yes.
Otherwise, if you had a full body rash, you're going to lose a lot of heat. You're going to get shaking chills. I mean, it when your skin is damaged. Yeah. So it can give you some systemic symptoms. Yeah. Then also autoimmunity. So people may have lupus or psoriasis or thyroid disorders that present in the skin. Yeah. And so our immune system kind of helps our skin and everything kind of work with that as well.
Yeah, I remember reading a nice example. The skin is almost like our body's raincoat. It kind of protects you from the outside environment, keeps the moisture and heat. So a lot of stuff like heat regulation, moisture, and not just the aesthetics and the glamour side of things.
Yeah, no, absolutely. There's a role for the glamour side. That's for sure. We do enjoy doing that, but that is not the majority, and that's not the reason that most of us went into dermatology.
Absolutely. So, in your practice, what kind of skin disorders or pathologies are you seeing more commonly, and what do you like to focus on in your practice?
So because of where we live here, or where we practice in hill country, there's a lot of pollens in the air, mold, cedar, all that. So sometimes atopic dermatitis is a big one, eczema. Okay. So that's a big one in children and adults. And I feel like that is a little higher chance of seeing that here in this area.
Yeah.
Skin cancer for sure. We have a big retirement community in here. We have people who move all over from Texas and out of state, and so a lot of them are retirees, and so they're out playing golf and enjoying life, and they're hiking and they're getting more sun. So we see a lot of skin cancer also. So those are probably the two most common things. Now acne, of course, acne is all across the country, all around the world, men and women for sure. So we do see a lot of acne as well, and then many other things for sure. So those are the most common.
And as you say that, there are so many questions that come to my mind, but so let's talk about skin cancer first, right? We hear about or talk about like yearly skin exams, right? What's your take on that? And what's the right age to start? And is that for everyone, or who should be getting those?
So for sure, we have I always forget the whole name, but United States Preventive Task Force. They have not found enough evidence to advise every American to get that done. Not yet. So, but there are certain subsets that they say maybe. So Caucasian males over age 50 is a big one where you might see more melanoma. Because the whole point of the Preventive Task Force is to save lives. So that's what they're looking at is where does it count, And so that's the one. And also someone who has a first-degree family relative with melanoma. So mom, dad, siblings. So a lot of times people say, hey, I have a lot of melanoma in my family. Well, it turns out, only one had melanoma, but 99% of the other ones were basal cells or squamous cells. So those patients don't necessarily need annual exams. But if you have a first-degree relative, even if you're a child, you should probably at least get checked.
Absolutely. And so typically, people will see a small mole or lesion on their skin, and they kind of watch it for a while. And after a while, it starts bothering them, and that's when they seek care, right?
Sometimes. Sometimes not.
Sometimes. That's true. So what would you advise as to, what should be the alarming signs or red flag features that they see that they should not ignore and definitely get, that mole check?
So I always say something that's not healing, something that's itchy.
Okay.
Maybe hanging around over 4 weeks. Sometimes I'll have someone who calls and they've had something for 1 week. Well, you probably want to give it a little time because sometimes benign things will heal up quickly. But if it's been over 4 weeks, it's bleeding, itchy, any of those kind of things. And then I always say, ugly duckling sign. So say you look at your back in the mirror and you see, there's one that's standing out to you, or even one that you see and you're not sure why. Hey, I think I've had that mole a long time, but it stands out to me now. And that's a reason, I think, to get checked out.
Okay, absolutely. And then you mentioned acne. That's another, a topic or process that I think pretty much everyone gets affected by to some degree at some point in their life. From a regular maintenance standpoint, or young people growing up as they go through like puberty and, those hormonal changes, what are some of the key skincare routines that they can follow that can prevent it from getting worse?
Washing your face. I always say wash twice a day. Maybe use a soap-free cleanse or something gentle pretty much. And now if they haven't tried, if they've done that and their skin is not too sensitive, they can go to salicylic acid cleansers, maybe something with benzoyl peroxide. Those are nice, simple, over-the-counter things that they can do. Dappling 0.1% cream. That's one that used to be prescription. I used to prescribe it for my sensitive skin patients. Now it's over-the-counter. And there are different brand names that are out there with that. And that's the first thing you can try just at night, at bedtime, just very sparingly. It's drying sometimes. So those are nice, simple things that you can start off with. And then if that's not enough, then go seek care with your dermatologist, and they can get you prescriptions.
Absolutely. And then along with those things, as you talked earlier, with skin, the UV exposure and sun exposure becomes very important, to protect yourself from that. What's the right SPF? Is there a right SPF? Because, we see a lot of advertisement around that or marketing. What's the experts' take on it?
So the American Academy of Dermatology recommends SPF 30 or higher, and one that's broad spectrum.
I see.
So it'll say broad spectrum. It may say UVA, UVB spectrum, or it might say zinc or mineral. Those are nice broad spectrum and sunscreens.
Okay. And is it all the time, every time? What's the threshold for like sun exposure where you should be wearing sunscreen?
So pretty much anything that's sun exposed, anything that's out, like your face, that's a good place that, we don't keep our faces covered typically. So that's a good one. Ears for the men, especially, or women who have short haircuts. If you're wearing short sleeves, especially here in Texas, right? We get lots of sun here versus the Northeast. I would put on your arms, maybe your V-neck chest. A lot of people forget this part of your chest, and that's where we age a lot too, by the way. So sunscreen does help even with it's like your anti-aging, tool.
Kind of slow the process down and make sure to protect the skin. Perfect. Yeah. Absolutely. Pivoting a little bit towards the aesthetic side. I know you also have a pretty extended list of services or treatments that you do. Tell us a little bit about the different services that you have at the clinic, and then what is something that people should do as part of as they normally age, consider those procedures or those treatments to help their skin, age gracefully.
Yeah. So what we were talking a little bit in the beginning, that's, sunscreen. Okay. Number one. Yeah, simple. Absolutely. Like I had mentioned that some people come in and they ask about anti-aging, but they're not even using sunscreen. Yeah. I also recommend a hat, so broad brimmed hat, because that's like if you're going to invest your time and effort and your money into that, you've got to do the basics. Yeah. And then at night, use a retinoid. So these are just some basic skincare regimen, and there's many retinoids out there. Some are prescriptions. Adapalene 0.1. That's a true retinoid that's over the counter now. Okay. And then there's retinols. Retinols are not as effective or as potent as retinoids, but those are also very many retinols out there. So if somebody wants to start with a retinol at night, that's a good idea. I see. Okay. And then there's many other steps we can get into also.
Yeah. So common, like these days where people, we hear a lot about peels, right? Chemical peels, and then microneedling. There's different types of that, right? And then obviously Botox and fillers. Those are kind of part of that as well. Where does peels and microneedling? When do those come in? Are you waiting for certain signs to do those, or would you recommend that as a
I get this question all the time. Yeah. So people ask about preventative Botox or preventative microneedling. Yes. If you're, and this is partly genetic, it's also partly how much sun you're getting and things like that. If you're a smoker, we know smokers age much faster. So it really depends on the person. So sometimes you can have a 25-year-old with deep lines already, just genetically, they already have them. Yeah. So that person, I might be recommending some Botox and microneedling. I can have a 45-year-old who has no lines and they're asking about prevention. I told them wait, just use this good skincare and sunscreen and then introduce. For preventative Botox, this is the whole thing on social media. I just think, wait on that. If you start to see the fine lines, okay, let's do it. And it'll easily relax those lines. Yeah. So there's no real age. Exactly.
Absolutely. It's more patient, specific in what they're dealing with. And this is also true that once you start using Botox, you kind of have to keep doing it because you won't right?
No, but you will get used to it and people like the look. And so that's really what gets people almost that addiction, It's not exactly that, but just, I don't like frozen. That's just, you always know when someone's done Botox when they're that frozen. Yeah. But just doing a little bit just to make them look refreshed. Yeah. And then you kind of get used to looking like that. Yeah. And then when the lines come back and you kind of look tired again. And so people like to just look their best. And so
kind of still keep it natural and, don't overdo it. But then you kind of don't like the old, your old self, right?
Yes, you kind of start to know when it's wearing off and people, got to make my appointment every 3 to 4 months. So, and then I have some who just do it before a wedding or they might do it before an event or for work, they might have a conference, and so they want to just look their best.
Absolutely.
So some people will just come twice a year.
Yeah, yeah. Another common thing which we also see at the primary care level is a lot of people dealing with hair fall or hair loss. Different degrees, men and women both. A lot of times, especially they move from somewhere else, change in water or environment. They think that's a big factor that plays in. What are some of the initial interventions? We do some topical treatments like minoxidil and stuff like that can be done at a dermatology level or more in terms of interventions. What can be done to slow down or even, prevent hair fall?
So there's a lot of over-the-counter things now. And the only thing that's FDA approved for hair loss that's over-the-counter is going to be topical minoxidil. And I always say minoxidil 5% foam. If they don't like the foam, then the solution's okay. The foam doesn't have propylene glycol, so it's kind of nice, sometimes less itchy. Yeah. Except my patients don't like it, especially my women with long hair, because it's greasy. Yeah. And that's the hard part. And also my men and women, it's hard to remember to use it. Men use it twice a day, every day, forever. Yeah. And women, it's once a day. And it's just a lot. People forget. Yeah. So, and it's realistic. But that's the first thing is try. Okay. I also recommend a good hair loss shampoo. There's many options there. there. One of the ones I recommend is Nioxin. It just helps beef up the density of the follicle.
I see.
And then vitamins. So you can get hair vitamins. There's many options out there too.
Okay. All right. And in terms of procedures, once they are having those issues or, these things aren't working, we know hair transplant is the eventuality. Some people will get there, but if someone's trying to not get there, what can they do from a procedure standpoint?
So procedure wise, I like PRP.
PRP, okay.
But before you get to PRP, some patients come in, they just are requesting that. Before I get there, I like to stabilize the follicles by giving them medications.
I see.
So medication's probably first.
Okay.
And there's finasteride and there's minoxidil. For our women, spironolactone. So those three are the options. Men can't take spironolactone or shouldn't, at least for hair loss, they shouldn't. Blocks effective testosterone.
Yeah.
Then after they've been kind of maxed out on that, and it takes 6 months to see changes every time you do it. Then I might say, hey, let's introduce PRP, which is called platelet-rich plasma.
Yeah.
We draw their blood, we get quite a good amount, maybe about 22 milliliters of blood. And then we'll inject that back, and we harvest about 6 milliliters out of that of golden PRP, and then I inject it back on the top of the head. Okay. And you do a series of 3 to see if it's working or not.
Okay. And then that plasma basically enriches the follicles and helps kind of regenerate them, right? Correct.
You're throwing a lot of growth factors at the follicles, so that's what the PRP is for.
For more
all the medications, they help decrease shedding. So it's kind of working together.
Absolutely. Okay. A little bit, pivoting towards, some personal life and, how you balance a busy career in your practice. I know your spouse is also in healthcare and a physician. How do you maintain that balance, or what do you do to kind of, keep the family happy as well? So
I have 2 boys, and they're middle school, so they're pretty independent, actually, to be honest. They're healthy, doing well in school. They're happy,
Amazing, great.
We have my mom is in town, so I have my own practice. So you're also running a business at the same time as being a full-time doctor, seeing tons of patients every day. Yeah. And so fortunately for what I do, I typically have weekends off, so that does help me. Versus my husband, who's a cardiologist, and his schedule is a little more erratic. So at least one of us has a little more predictable schedule. And so then because I have family members, that does help me a lot. So again, I have a very good supportive school. And this is one thing that actually I want to bring up is that a female dermatologist back in training, she told me that it's the golden triangle. You have to have your work, your kids' school, and then your lit home. Yeah. That triangle, if you have it as small as possible, that will be the number one thing you can do. And I always remember that. Yeah. And that's what I've done. Luckily, with where I am, all 3 are as close as possible. Yeah. So you're spending the least amount of time on the road. Yes. And if I have to get over there real fast to quickly go get something, then I can. So that is probably the most important advice that I've ever heard, actually. Absolutely. Going back to dermatology, in terms of things coming ahead in the future, we were, talking about this recent article you were mentioning in JAMA. What do you see, on the forefront? What are you excited about in dermatology as far as things coming out? What am I excited about? Gosh, that's a tough one. Because sometimes in the cosmetic realm, there's new technology or things like that. Then in the medical side, there's a new therapy. And we have all these new therapies now that are fast-paced coming through with biologic immunotherapies and things like that. And they're coming fast. And so we're having more and more options now. And they're so specific on the immune system. So they're not less side effects as well versus some of the older generation ones, which are broadly immunosuppressive. So, on everywhere, really, there's in every aspect, I feel like there's something new. And that's true for everything in medicine. Everything is very fast. Got to become more specific. We hear a lot about peptides and, exosomes and those kind of things. Sure. Yeah. Are you seeing some data or stuff in dermatology for that, or what's your... I feel like there isn't... Yes, we hear about it all the time. Yes. Some anecdotally, patients or people, practitioners feel like, yes, there are some that maybe are better. And this kind of is related to the PRP side, with the exosomes and all that. But there's no real hardcore for me evidence that is robust to show that they're helping. But, we may never get that. I mean, we're not going to ever get funding for a big clinical trial for something like that. Yeah. But there is some promise. We'll see what happens. Yeah. And I feel that's a emerging challenge that we as medical professionals face today.
that, we obviously need the data and all the studies to kind of really, stand behind something and feel comfortable or confident. But with the social media world out there and how things are kind of, projected, it's almost like, we're kind of saying, no, this doesn't work. And the whole world is saying this works, but not a lot of people are looking at the data.
No, that's true.
Yeah.
And we do have, there's an epidemic of influencers out there
Yes.
who, I'm sure there are some who are doing positive things, absolutely. But we got to remember those people are earning money by giving advice. And, they may not have the education and training and experience that we have.
Yeah.
Again, they have their role. I'm not saying that influencers are definitely have some good positive things. They give us a lot of entertainment, that's for sure.
Yeah.
But, we probably, as a patient population, probably shouldn't just rely on that as their number one information.
Yeah.
Mm-hmm.
Yeah, make sure you're getting all your information, going to a reliable source, definitely staying in touch with having that relationship with your physician, who you feel or trust, to provide care, and then making those decisions.
Absolutely.
Perfect, cool. Yeah. All right, so Dr. Muñoz, we were discussing about the importance of nutrition in skincare. If you could tell our audience a little bit about, how closely nutrition and, making sure your micronutrient levels are good for your skin, that would be amazing.
Well, there's different kind of elements in that.
Yeah.
So there's one, we talked a little bit about that new article that just came out for skin cancers. So they're recommending, this is something that's been around a long time, but nicotinamide.
Yes.
And that's vitamin B3. And so that's a powerful antioxidant. And you can take it as just an over-the-counter supplement. And so if you've had skin cancer, then we've always said this, but it might be a good idea to take nicotinamide 500 milligrams twice a day.
I see.
It's also called niacinamide.
Yeah.
We're not talking about niacin,
Yes.
but nicotinamide or niacinamide.
Okay.
And so there may be some support. And actually now there's the article that talked about 34,000 veterans that if you've had basal cell or squamous cell, it may reduce your risk of getting a second one.
Okay.
So that's one. There are also polypodium leucotomus, which is a fern extract, and they actually can combine that. That's a powerful antioxidant. And you can actually find that along with nicotinamide in one supplement. There is a specific brand out there that does that.
I see.
And that's a good one as well. So if I have some with lots of skin cancers, especially squamous cell skin cancer, then I actually talk about that.
Okay.
So skin cancers, even you wouldn't think so, but antioxidants then repair beauty damage.
Okay.
So that's one. And then hair loss, we talked about a little bit about that, but there's actually supplements in the hair vitamins, and even by itself, saw palmetto, ashwagandha root, marine collagen. There's a whole bunch of different options.
Yeah.
One thing I don't, or I kind of discourage, I'll say, is biotin. So that is one that's kind of in the past. I used to talk about biotin all the time, but now I'm less and less, and the FDA issued a warning about biotin because it can interfere with cardiac enzymes, it can interfere with thyroid testing.
Yeah.
So the FDA now has issued a warning on excess biotin pretty much.
Okay.
So that's one that people should probably tone it down if they're taking lots of biotin.
Yeah, just kind of balance it and make sure you're taking the right recommended amounts, because sometimes it's very easy to overdo with these supplements, right?
Yeah, we talked about turmeric, right?
Yeah.
Turmeric is antioxidant, anti-inflammatory, really great for joints and things like that. But too much turmeric can lead to liver issues, right?
Yeah.
You want to just nothing in excess, really just moderation.
Yeah, I think the important message there is that even supplements, if they're you're taking for the right reasons, they have to go through your body, and your liver or kidney, those organs have to metabolize them. So you got to make sure the levels are fine. Now, since we have you in the house, like from a dermatologist, what is your skincare routine that you follow?
Absolutely, yeah. I like to use a good, I won't get into details into brands, but I do like to use a good exfoliating cleanser, one that's gentle, once daily. The opposite time of day, I usually use just something with micellar water that's good for sensitive skin to take makeup off.
Okay.
And then I'll use a gentle cleanser.
I see.
But in the morning, I'll always put hyaluronic acid on first. I might also add maybe an antioxidant serum like vitamin C, vitamin E, usually one that has lots of them already all in one layer.
Okay.
And then sunscreen. So on top, I usually put a moisturizer, and I use fragrance-free everything.
I see.
And then I put my sunscreen as my last one. And I tend to personally use zinc sunscreen. I try not to use too much chemical-based sunscreens, but they are known to be safe. It's not that it's not. I just prefer to use a mineral-based.
Mineral-based,
like zinc or titanium.
I see. Now, the important question Does your husband also follow a similar skin routine?
Okay, that's a fight, a little bit of a fight, but he's a big boy, he's an adult, he can do what he likes, but I do try to get him to wear at least a hat, especially with thinning on the top.
Yeah.
And then, and sunscreen, absolutely. But it's hard to even get him to wash his face and do the normal, especially a facial cleanser.
Because whenever I think about a skin routine for myself, it lasts like 2.5 days, and then I forget, all the different things that you have.
And that's important. You don't want to ever tell someone to do multiple steps.
Yeah.
But just keep it simple. And they have a lot of combo type products that are out there that are all in one step. So.
Cool. Mm-hmm. I have a few really quick, like rapid fire questions. Like just one word answers, and then just kind of see, makes it interesting. So we talked about sunscreen, and I think you already answered this, but what was it? Chemical? Chemical? Yeah. Mm-hmm. So for sunscreens, what do you recommend? Chemical or mineral?
I recommend mineral.
Mineral, okay. Mm-hmm. And what's the perfect SPF to use?
30 or higher.
30 or higher. Mm-hmm. Does water intake really clear up your skin?
Don't think it clears it up, but it does make it look less crepey and looks a little more healthy, actually. So I would just keep hydrated.
Okay, all right. What's the best skincare product under $50?
Whoa, without getting into brand names, this is the thing. I don't know, adapalene, I talked about
adapalene?
that.
Okay,
yeah,
cool.
There's different brands out there. Adapalene 0.1. Unless you're breastfeeding or pregnant, then you can use adapalene. And of course, someone who's of age, not a preteen.
Okay.
That's another thing we haven't talked about is the whole rage, the whole preteens running to Sephora and Ulta and putting way too many things on their skin.
Yeah.
But anyway, adapalene.
Yeah. Mm-hmm. Okay. Perfect. So, Dr. Muñoz, for people who want to reach you and take care of their skin, where can they see you?
So we're out in the Fair Oaks area, just right near your clinic.
Yeah.
In Bernie and Fair Oaks, Leon Springs, and San Antonio. People come from all over, but they can call us at 210-698-0500. And we do take insurance. We take private pay. We take, basically take the majority of insurance plans.
Okay, perfect. Mm-hmm. And your practice is called Vista Dermatology?
Vista Dermatology.
Perfect.
And they can also look at our website, since they actually can schedule their own appointments through our website.
Great. Mm-hmm. Well, thank you again for doing this and then, providing our listeners with so much insightful information. We would love to have you again on the show.
Yeah, thanks for inviting me. That's great.
Thank you.
We had a good time.